Influenza, commonly known as the flu, has been recognized as a distinct disease for centuries, but the virus causing it was first identified in 1933. Before this discovery, outbreaks of influenza were often confused with other respiratory diseases. The 1918 influenza pandemic, also known as the Spanish flu, was one of the deadliest natural disasters in human history and prompted intensified scientific efforts to identify and understand the cause of influenza. This eventually led to the discovery of the influenza virus by a group of researchers including Wilson Smith, Christopher Andrews, and Patrick Laidlaw in the United Kingdom. Influenza, often referred to as the flu, is a respiratory infection caused by influenza viruses, and its route of infection involves several key stages, which can be described as follows. The primary mode of transmission of the flu virus is person-to-person contact. This usually happens through airborne droplets that are expelled when an infected individual coughs, sneezes, or talks. These droplets can travel through the air and land in the mouths or noses of people nearby, typically within a close range of about 6 feet. After these virus-laden droplets are expelled, they are often inhaled by another person through their nose or mouth. This is the typical entry point for the virus into a new host. Once inside the body, the influenza virus binds to receptors on the surface of cells in the respiratory tract. The virus then enters these cells through a process called endocytosis. Inside the host cell, the virus releases its RNA, which hijacks the cell's machinery to create more viral particles. This replication process rapidly increases the number of viruses within the respiratory tract. The newly formed viruses are released from the infected cells and go on to infect more cells in the respiratory tract, spreading the infection further. The body's immune system responds to the infection, leading to the common symptoms of the flu, such as fever, cough, and muscle aches. This immune response is crucial in fighting off the virus but is also responsible for many of the symptoms associated with the flu. Even before showing symptoms, infected individuals can shed the virus, making them contagious and capable of spreading the flu to others. The peak of contagiousness usually occurs in the first few days after the onset of illness. While the immune system of a healthy individual typically overcomes the virus within a week or two, complications can arise, particularly in high-risk groups such as the elderly, young children, and individuals with certain chronic health conditions. These complications can include severe respiratory issues like pneumonia and can be life-threatening. Preventative measures, including vaccination, maintaining good hand hygiene, and avoiding close contact with those who are ill, are crucial for minimizing the spread of influenza. Influenza, widely known as the flu, is characterized by a variety of symptoms that can differ in intensity and combination among individuals. These symptoms usually emerge suddenly and are more severe than those of a common cold. A hallmark symptom of the flu is a high fever or the feeling of feverishness, often accompanied by chills. This fever can be quite pronounced, sometimes reaching high temperatures. The flu typically brings about a persistent cough, which can be either dry or productive, causing discomfort in the chest area. Many individuals with the flu experience a sore or scratchy throat, a symptom that can be exacerbated by frequent coughing. Nasal symptoms such as a runny or stuffy nose are also common, contributing to the overall discomfort. Muscle or body aches are notable during a flu infection, ranging from a general feeling of achiness to more severe muscle pains. Headaches are another frequent symptom, often occurring alongside the fever. A significant level of fatigue and weakness is a common aspect of the flu, and this tiredness can linger, lasting for weeks even after other symptoms have subsided. It's important to note that while less common, some people, especially children, might experience vomiting and diarrhea as part of their flu symptoms. The onset of flu symptoms is typically abrupt, and the severity can range from mild to very severe. The flu can lead to serious complications, particularly in high-risk groups like the elderly, young children, pregnant women, and those with certain chronic health conditions. Early medical attention and treatment are crucial, especially for those at higher risk, as antiviral medications can help lessen the severity and duration of the illness. Treating influenza, commonly known as the flu, primarily focuses on alleviating symptoms, preventing complications, and, when appropriate, using specific medical treatments. The approach combines self-care strategies and, in some cases, medical interventions. Rest is a crucial component of self-care when dealing with the flu. It allows the body to focus its energy on fighting the viral infection. Alongside rest, staying hydrated is essential. Consuming plenty of fluids like water, juices, and broths helps prevent dehydration and can soothe symptoms like a sore throat and cough. Over-the-counter medications play a significant role in symptom management. Pain relievers such as acetaminophen or ibuprofen can help reduce fever and alleviate body aches. It's important to follow dosage instructions carefully, especially when giving medication to children and teenagers. To ease a sore throat, gargling with salt water or using throat lozenges can be effective. For nasal congestion, options include nasal sprays, saline drops, steam inhalation, or using a humidifier. In terms of medical treatments, antiviral medications are a key element. Drugs like oseltamivir or zanamivir can be effective, especially when started within the first 48 hours of symptom onset. They may shorten the illness's duration and are particularly important for those at high risk of complications. Consulting with healthcare providers is advisable, especially for individuals in these high-risk groups, which include young children, the elderly, pregnant women, and those with chronic health conditions. Preventative measures are also an integral part of managing influenza. The annual flu vaccine is the most effective method to prevent the flu. Practicing good hand hygiene and avoiding close contact with sick individuals, or limiting contact with others when you are sick, can help reduce the virus's spread. Immediate medical attention is necessary in certain situations, such as difficulty breathing, persistent chest pain, severe muscle pain, confusion, or if fever and cough worsen after initial improvement. These symptoms could indicate serious complications requiring urgent care. Overall, treating the flu involves a combination of self-care measures for symptom relief and medical intervention for more severe cases or high-risk individuals. Regular consultations with healthcare professionals are recommended for personalized treatment and advice.